Welcome everyone to today's first information session for Global Opportunities at the School of Nursing. It's great to see so many people turning out. You are welcome to show yourselves if you like. We would love to see you. Today, what I'm going to do is give you an overview of our global opportunities, and then you will have the opportunity to meet two folks who have been engaged in our what we call guided independent studies, and I will explain what those are all about. The best way to give you an overview of our opportunities and to give you something where you will be able to find this information on your own is to use our website. So I am going to begin by sharing that. And I will share screen. So this is our homepage. Djine, can you see it? Okay. So if you go to our homepage and you look at our expertise, we have a tab for global health. And I am going to put the link to this in chat so that you can all save that. You can save it and access it at any time. And on this page, we have a tab that's called Student Opportunities. Which is the place that most of you would go at any time. And here you can see our study abroad, global health minor, particular courses you might want to take, our nursing students for global health group, which we have the leader of that here with us today, Kiara Perez, information about the Peace Corps, and global happenings all around campus. These are all things that might be of interest to you at some time or another. But what we're talking about today is mainly short-term. Or would everyone please mute your microphones? Thank you. Sorry. What I think most of you want to hear about today is short-term and independent studies. So you'd click on this tab, and you will be able to find all kinds of information, more detail than we're going to go into today on any one of these opportunities. So I'm going to, just as an example, show you one that we're not talking about today, but that we will talk about in the future, and that's Spain, just so you see how these are laid out. So if I go to Spain, you're going to see the country, what kind of student, which students can apply for this, when it takes place, a description. You'll also be able to access one of these recordings from last year or the year before, but most likely you'll be interested in the most recent one, any prerequisites, and the finances of the course. So that's just to tell you, you've got lots and lots of information on each one of these icons. So anything that strikes your fancy, you can find lots and lots of information there. Actually, that's just about all I really need to tell you about this kind of opportunity that mainly are, well, sorry, I'm going to go through all of these for a second. Both Chile and China, at this time, they are both led by Penn Nursing faculty, but they are offered as Penn Global Seminars, which are a separate application process. And if we were to click on this, and they're both offered in the fall, if we were to click on this, we would see that the application is handled through Penn Global Seminars. And the great things about Penn Global Seminars are the program fee. It's incredibly inexpensive, $950. That includes your air. Every time I look at it, I sort of can't believe it. It includes your airfare, all of your travel expenses. The only thing you might have to cover yourself is maybe a passport if you don't have one. And some out-of-pocket expenses here, they're telling you $280. In addition, if you are a student who receives a good amount of financial aid, there is a very good chance that part or all of that $950 will be covered by financial aid. Which leads me to another point, which is that we really want every one of you who has any interest in global experiences to have one. That is a commitment we have from the School of Nursing and from the University of Pennsylvania as a whole. No matter what your financial situation, we believe it should be possible for you to engage in one of these experiences or more. I have had students over the years who are among the most highly aided, who have had 4 different global experiences while they were here at Penn Nursing. So it is absolutely possible, and I encourage you to explore to the degree that you are interested. So again, that's Chile and China are both offered as Penn Global Seminars. We hope to have additional Penn Global Seminars offered through Penn Nursing faculty, but that's to be determined. Also, what's special about Penn Global Seminars is they are designed for all 4 undergraduate schools at Penn. So you would take these classes with Penn Nursing students, with Wharton engineering and college students, which means you get a nice exposure to students that you may not see on a daily basis through your nursing curriculum. I'm going to skip over France, Ghana, and point out that for those of you who really don't feel ready to travel or things just don't work with your schedules, we also have 2 virtual courses that can meet the requirements of a global health minor and that also give you tremendous global exposure, even though it's virtually. You just don't set foot in another country. And Kiara, I could point to Kiara for 3 things today, for the experience she's going to tell you about in Mexico, and also for her role with nursing students for global health. And then she also was a participant in 1 or more of these virtual courses, but you'll hear from her about that in a future information session. So those 2 are virtual. Then we have Spain and Thailand that are both courses that incorporate a whole semester of classroom time with a probably 8 to 14 days of travel with your faculty person. That means that you are going with your classmates, you will be with your faculty, and it's very comfortable for anyone who's not interested in traveling alone in these locations or traveling somewhat independently. So now I am going to tell you about the courses that do require a little more independence, which is what our focus is today. It's what I call guided independent studies. And the way these work is, these were designed for you, for students who would like to have more independence, more immersion in culture, and are not concerned about doing this relatively independently. It is not fully independent because I am the course director for all 3 of these experiences. They are all arranged with close partners in country. And there's nothing to really worry about, except that you would be getting on a plane by yourself. You'll be met at the airport by our partners, and you will have a fabulous time getting to really know the countries you're in and have great experiences. For the experience in France, MISEFA, we don't have a student to talk to you about this today, but you will be able to see all the information you need. It's going to be held from May 31st to June 29th this year. This opportunity is always 4 weeks in length. And there are information sessions from last year where you will hear from students who participated if you want to access that recording. And then you can look at our partner organization in Paris, MISEFA. You can look here to see information about the program. French language skills are desirable but not required. But like all these independent studies, guided independent studies, flexibility and confidence with independent travel is something you will need. And they're quite expensive. So these guided independent studies are of some length. So with your $2,800 will include your lodging in Paris. It will include your local transportation courses, expenses, and your orientation, as well as the course itself, because this is a public health oriented course. This is in addition to the 2,800, you will have the out-of-pocket expenses of airfare and meals and any other personal expenses. So they're not inexpensive, but these two qualify for financial aid. The program fee part does. So I'm going to then show you Ghana is 4 weeks in Ghana in West Africa. And we held this opportunity for the very first time last summer. And Djine Mentor, who is here, will be able to tell you something about her experience. But this is one that is, we think, we're very excited about having an opportunity like this in Ghana. And we hope it will become more and more concrete. But right now, it's really a course that is best for a student who's willing to very much go with the flow. We say that for all global engagement, even if you were 30 years into a professional career in global work, flexibility and the ability to pivot is always very, very valuable in general in life, whether in the United States or abroad. But when abroad, it can be even more necessary. So I will caution you to keep that in mind. And then I'm going to bring you to Mexico. This is a longer experience than the other two. It's 6 weeks in length, and it will you need to have the equivalent of 4 semesters of college level Spanish before you can engage in this experience. When you go to Mexico, to Oaxaca, it will include a couple of weeks of formal language learning, where you will be placed through a test to see exactly which group you belong in. So you'll get formal language instruction, and then you'll have 4 weeks where you're engaging with community in a kind of health education environment. This is I think, incredible experience. And again, I've shown you where to find all of this information. I am going to stop sharing at this point because I would like to, I would like you to hear from Kiara, who actually had this experience last summer, and she can tell you from her perspective. I also want to invite you all to put any questions you may have in chat, and we will have plenty of time today to also answer any questions you have about the general opportunities or any of the specific ones you'll hear about today. So Kiara, would you like to tell us, maybe start with how confusing it was, how little you knew about what you were going to do, and then once you got there, the highs and the lows.
Okay. So the program was it was pretty mapped out, I think. Like Nancy kind of mentioned, I think probably more than the Ghana one, just because we knew, like, when we got there, we were going to be taking courses at this institute. We were going to be taking Spanish classes. We knew we were going to be taking cultural classes. But there was a new component that I don't think Penn students have ever done before when we got there. We were told that we were, instead of doing work with this foundation called Envia, we were partnered with a clinic in the area, and which was a completely new experience. And it was also a little different for us because we couldn't walk there and we were used to walking everywhere in the area. So navigating public transportation in Mexico was also a new experience. But at this clinic, we were partnered with nurses and doctors in the clinic, and it's in an area that's a little more low income, so we kind of got to see what this clinic does for patients who also can't afford care and how that's managed in the clinic. And we got to learn a lot. We got to shadow a lot of doctors and get a lot of hands-on experiences with patients. It was also just we also had very busy schedules with school. We had the classes, we had the clinic in the morning for the last 4 weeks, and then we had the Spanish courses after that. So it was a very busy schedule, but I think the Spanish courses and the 2 weeks of general Spanish definitely prepared us for the work we were doing with the community. Um, and yeah, it was a very immersive experience, I would say. We were definitely given a lot of freedom, I guess, lots of responsibility to just really explore the culture that Oaxaca has because it's very diverse in its culture, and I think it's very different from a lot of areas in Mexico. So I think it was very educational, but also just personal growth kind of experience.
So, Kiara, it was from the reports that you and two other students who went with
Hmm.
you wrote, it was quite challenging, all the things you had to fit into your time, and like
Yeah.
you just said, figuring out things that you didn't expect, like how to use public transportation. Now,
Hmm.
I'm gonna lead you along to say this, but you can say something different than I want to hear. So what I want to hear is, how enriching was that you were forced into all of this, and how much more did you gain because you weren't sitting around doing nothing? Okay.
I mean, it was very stressful at times just because a lot of things we literally found out like the day before that we would be traveling to another area or that we were going to be have to take public transportation. But I think the people at the clinic and the people at the institute definitely helped us with any stressors we had related to that. Like for public transportation, they kind of showed us how it goes for the first 2 days, and we kind of figured it out from there. But there was times where we were a little confused and scared for what was going to happen. Um, but it all worked out well. The clinic definitely was a new experience, and we also traveled with the clinic, which was a new experience. We went on a 5-hour drive to kind of like the middle of nowhere, which sounds a little scary, as you can imagine, with these people that we didn't really know yet. But we got to meet with people from a clinic in another area that they're partnered with, and it was like kind of like a workshop over a weekend where we learned about kind of their version of social determinants of health. They kind of had different terminologies for it, but they discussed how they were tackling that and those issues in their communities. And it was really cool because we were kind of like in a secluded area, like in the mountains. So that was very different from our experience in the city of Oaxaca.
Thanks, Kiara. Um, I have lots of more questions here, but I hope some of the students who are on the call will have questions for you later also. Djine, for their experience in Ghana, let me say first to everyone, we have, it's actually one of our graduates from Penn Nursing who is our main contact for this experience in Ghana. She's right now with the NIH. Dr. Polly Joseph, she's a fantastic person who for years has been working with the Amazing Grace Children's Charity. And that entity is led by a nurse of Ghanaian origin who works here in the United States in New Jersey. And she basically used her own personal resources to to work on the establishment of a children's hospital in Ghana. While that hospital is being constructed and little by little they're making progress with that, they organize groups of people who go to Ghana to work on kind of what they call missions, where they're focusing on one particular topic or some kind of impact they can make on the community they plan to serve with that future hospital. So Djine Mentor is the first student who dared to go out, and she went all by herself. She did not have a second student to go along with. Kiara was with two other Penn students, and for Mexico, every year we've had at least two students go. Stepping back, and we've had 2 to 4. Four is the largest number they want to accept at one time because it is a very intense experience. I can tell you for France also, we've never had more than 2 students, and we have had 1 single student go to France. And now we've had 1 single student go to Ghana. And Djine, can you tell us about jumping into the void of not knowing exactly what this would be and then what it became for you?
Yeah, sure. Like you mentioned, I was the only student to go. I think my parents were more worried about me being the only one to travel outside of the country for 4 weeks than I was. I always feel like I'm like a very adaptable person, so I wasn't really anxious about the traveling. I'll say that the process was very different because there's like we had a lot of moving pieces when it comes to like putting the trip together and making it happen. So that was the most like stressful part about the whole process, I'll say. But as soon as I landed in Ghana, I was welcomed by like one of the staff members from like the Amazing Grace. And I stayed in the house there was always someone else in the house with me. So I was never truly like alone. Um, and the way the whole thing worked is that when I went, I had like two quote unquote clinical rotations, what they'll call. I was placed in like I got the opportunity to shadow like two different hospitals. I was in a public hospital, which is sort of like a clinic that served more the underserved areas of Ghana. And I was also placed in like a private facility that had like more resources, but but again, not to the extent that maybe Penn Medicine would have. So that was like really interesting. I got to spend like, I would say like about a week or so in each facilities, just like shadowing the nurses, seeing like what they're doing and just like learning from them. Um, I'll say being by myself wasn't the most challenging part. I think not being able to speak the language that most of the people speaks in Ghana was the most challenging aspect of it. So when I interact with the underserved area of Ghana, they speak like the part that I was, they speak like Tree. So that was it's completely different from English. So that was like kind of like hard to manage because I'll interact with the patients. They'll like smile to me and like try to talk to me, but I wouldn't know what to tell them because I didn't speak Tree. The only thing I knew what to say was like thank you. And they did teach me how to say like good morning and how are you, but I haven't practiced, so I won't try here. So that was it. The private facility was kind of like a different experience because like most of the people were kind of like on the wealthy side, so they all spoke like English. So that was like I guess um closer to what I'm used to when I go to clinicals. But other than that, I don't. Yeah, be going alone wasn't that scary. I never felt like I was by myself because I was always with people.
What would you say the highlights and the lows of the experience in Ghana were, Djine?
Okay, I think I'll start with the lows. It's like the heat. It's like so hot in Ghana. It's like so hot. It's like the first day I remember like I nothing could have prepared me for how hot it was in Ghana. I obviously adjusted to it by like I don't know, the end of the first week, but it was extremely hot. Like I brought like jeans. I usually here I wear like baggy jeans and stuff. This it wasn't working. It was like so hot. You need like thin materials like of jeans because the type of clothes that you wear here in the US, you have to like 360 your whole closet. So getting adjusted to the heat was like a big one. Also transportation, because there were they like I tried like public transportation with people just to like get the full experience. That was like also like kind of challenging because one, I don't know where I'm going. I don't speak the language. And the moment they see me, they're like they can tell like I'm like not from here. So they'll also try to speak English with me, which made it like that was really nice. But I was also trying to like kind of understand what they were saying. Public transportation in Ghana is like completely different. These are not like their system. It's not something they do have buses, but it's like it's not the buses that you guys are used to in the US. I feel like since I'm from Haiti, it's like familiar to home, so it wasn't like that much of a surprise. But it was like getting immersed back into that type of public transportation after like not being home for a while was like a shocker. And they also have like Ubers, like similar apps to Ubers that made it like really nice. To like travel around. I'll say the one of the things that I liked the most was the people and the food. I feel like I had like a great experience because of the people I was with. And although I was the only student there, again, like I mentioned, I felt like so welcome that I left Ghana with like a family. I feel like I left a family there. And I feel like that could just be me or like how I approached the whole experience. But I genuinely left a family there in Ghana. And when it comes to the Amazing Grace Children's Foundation, Dr. Biller, I know you're aware of that. They're like celebrating their 10 years anniversary and they're having like a huge like um health mission happening again. And that's something I'm trying to see if I can squeeze into my schedule, which could be challenging, but that's how much of like a connection I developed with these people. And I feel like that was the highlight of my summer. I still talk to a lot of them now. We still reach out to each other and check in. I genuinely met like amazing people there, and I'm so grateful that I did the whole experience, even if I was the only student to go.
Sorry, Jean, I didn't understand, like, even if you were what?
Even if I was like the only student, like
Oh, okay, okay. And, you know, for me, listening to both you and Kiara, I see it so differently. Like for Kiara, and she said, oh, the stress of this last minute trip and these 5 hours going to the mountains. Then she knows that I was stressed also, because for me, as the course director, I was asked first, is it okay to bring the students for this opportunity? But both Dean Villaruel, who is actually the person who originally made the contact with this institute more than 20 years ago, she and I were like, oh my God, what a fabulous opportunity. They're going to get to go to this sort of in-service weekend in the mountains. And it's like, we hadn't even scheduled it, but for her and the students, the other students, it was like, well, should we go? Shouldn't we go? And for me, because I had never sent students to that place before, I was worried, but at the same time, I was so excited for them. And I thought it was like, wow, this is like great. And then for Jean, being going alone and getting all the attention of the partners there, I see that as a privilege too. Like their focus is all on you and it's all for you. And you get to have, be protected from the distraction of other students. I think all of the experiences we talked about today and all of the opportunities that are there for you, there are pluses and minuses of every one of them. You know, if you go on the course to Thailand or to Spain, you are guaranteed of having, you know, another 12 to 15 Penn Nursing students with you and faculty who you may know from your clinicals. And so there's a lot of comfort in that, and there's a lot of wonderful shared experience, but you're unlikely to learn how to use the local transportation all by yourself. And also the way you see things when you're with a group, for me anyway, has always been different from when you're doing it sort of on your own. But I've said enough for now. I am hoping that some of you will show us will put your cameras on, but you don't have to put your camera on to ask a question. Would any of you like to get into the weeds of these experiences? Any that I sort of outlined for you online, or specifically from Mexico or Ghana? Any questions, any worries, anything? Carolyn, you may have just done the camera because you were willing to show your camera, which I appreciate, but do you actually have a question also?
Yeah, so this is more of an in general question, but so I'm still a freshman and I know, so I haven't done my writing seminar for next semester, but a lot of people say like you have like your global opportunities, but like as a freshman, what should I be looking for whenever I'm like trying to do my schedule and figure it out? Like to try to like fit in one of these, do you know what I mean?
Yes, well, I think again, Kiara and Jean can probably tell you something about fitting things in, but typically I believe these courses are often, the faculty try to offer them at times that are not the most typical time for regular classes. That doesn't mean there won't be a conflict with something you're taking for general education. I'm excited for you. If you have not done your writing seminar, anyone who has not done writing seminar yet, there are probably 2 or 3 choices. I'm not sure. I haven't looked at the list right now for spring courses that include that you can accomplish your writing seminar through a Penn Global seminar with travel. So if you have not yet completed your writing seminar, this might be a great way for you. Keep in mind, now you will, you know what, I'm sorry, I am going to share screen again because I did not show you this part of the website. Let me grab that again and go back to the links. All of these items were Penn Nursing sponsored opportunities. even though these are Penn Global seminars, but our faculty teach them. Then if you keep going down, there are a number of other opportunities, and I apologize for not showing you this to begin with. There are internships that are a minimum, typically a minimum of 8 weeks in length. There are a couple that you can do in India. There are many, many, many opportunities in through the GRIP program, Global Research and Internship Program. And these are organized, this is offered by the Center for the Advanced Study of India on Penn campus. And they would love to have Penn Nursing students, and there are a couple of opportunities that are health focused. Then GRIP is a Global Research and Internship Program offered by Penn Global. Again, they love to have our students participating. And among the internship programs, the Pulitzer Center is one that I personally, through my work with PLAC, which is Penn in Latin America and the Caribbean, am very involved with. And this is one this is a GRIP opportunity that is great for a student who loves to write and who might like to develop their journalism skills. And then Penn Global Seminars is what we were just speaking about with Carolyn, I think. And this one is among the Penn Global Seminars, you've got hours that our faculty offer, Chile and China. And you've got a number of writing seminars, and they're just amazing opportunities. So again, I encourage you to explore this page. The link is in chat. But Carolyn, back to your question, the one thing to think about is if you look at all those Penn Global seminars, because they're offered by Penn Global, Penn Abroad, they're offered to all undergrads on campus. So they are competitive to get into, and the cost is so highly subsidized. So they are competitive to get into. So but they want every undergraduate student to be able to have one by the time they graduate. The writing seminars are specifically good for the first year students. Some of the other opportunities you're more likely to get in your junior or senior year because they want to make sure you don't leave Penn without one if you wanted one. However, if you've already done, let's say, the writing seminar, I think it's less likely that you'll get into another seminar, another Penn Global seminar. That doesn't mean you cannot do our classes in Spain, Thailand, or a semester abroad. But for the Penn Global seminars, they've never said this like it's a rule, but I just figure if I were the faculty leading that class and I had, for China, for example, I think they had something like 90 applicants for 20 slots. And those are all approximate numbers, but there were a lot. And the faculty had to decide which of these students do I place here? And they were more likely to place students who had not had another global experience or who, in the case of our own faculty, they might have placed someone who was who was already established a lot of interest in global, maybe even they were a global health minor. So it's like a roulette wheel. I can't tell you exactly what will happen. You know, you could look at it as a bird in the hand is worth two in the bush, if you still know those expressions. Or you could look at it as I want to save all my betting chips for the opportunity I want most of all. The problem with that, though, is you can't be sure which seminars will be offered every year. They change from year to year. I hope that hasn't been too confusing. Carolyn, did you have any other questions regarding that?
No, that's all. I just need to figure out what writing seminar to take next semester because I wasn't able to fit one in this semester. So I know there was some overlap. So
Okay, good luck. Keep us posted.
thank you.
Any other questions, general or specific?
I think there's like a question in the chat.
Oh, thank you, Djine. Let's take a look. For Ghana, how is a living situation on a day-to-day basis?
Okay. So for Ghana, my days were pretty much like structured. So I'll have to be I was supposed to be up around like 6 a.m., 7 a.m. because of traffic. That's a really huge thing. So for us to like get to the hospital on time to start at the same time the nurses start, I'll have to be there around like 8 a.m. or like 9 a.m. And that usually means like getting up early to avoid the traffic. Then we'll get lunch. Lunch was provided, so I never had to pay for my own lunch unless I wanted to. And since I was the only one there, lunch was basically based on what I wanted to eat. Um, that was like a good thing about it too. And then after lunch, I think midday, I wouldn't stay the entire day with the nurses. I think at some point the hospitals is just like it gets like downtime and there's nothing happening. So after that, they'll come get me from the hospital, and then we'll have like debriefing sessions to talk about like what I've learned today. And then I'll have like dinner and also have like a quiet time to work on my assignments, like my paper, my presentation, and just like gather data of what I'm learning. On the weekend, it was like more like touristical on the weekend. It would just be like traveling around. I went to like Cape Coast, the Cape Coast Castle. I went to like a hiking park. The weekend was mostly your downtime. I mean, because it was only me, I was telling them like they had places that I had to visit that were like staples in Ghana that you had to go to, and then but I also had room to like visit other places that I wanted to visit, that I wanted to go as part of like to sort of get like the touristical aspect of it. I'm not sure if I answered the question, but if you need more clarity, just let me know.
While Emmanuel is deciding if he would like more details, this stimulated a question for me with for both Kiara and Djine. Do either of you feel like you made any kind of contribution to the communities you were in? Did you make a difference in some little way? You know, you each there for Djine was there for 4 weeks and Kiara was there for 6 weeks, but 4 weeks actually working with community. Do you feel any satisfaction about what maybe you gave to your hosts and or the community? Kiara?
Yeah, I think the work with the clinic was very rewarding, and I think we contributed in the sense that we were able to collaborate a lot with the nurses and doctors there that I guess didn't really know much about like how we do a lot of healthcare in the United States. So I think collaborating with the clinic and giving them a lot of what we've learned in our education here, I think we gave in the community in that sense a lot. We also worked with patients, but I think it was very like basic work. We did a lot of vitals, like triage, and we gave a lot of our efforts in that sense. But I think a lot of what, for me at least, what was most rewarding was the relationships that we made with the people from the clinic.
Fabulous. And you raised I think an important point for everyone who's interested in global. This question of what you give. When I speak to even graduate students in nursing who want to be very engaged in global, if they ask my advice, or even if they don't, I'll often say what I think is most meaningful in global work is leaving behind something folks who live in the country are going to be able to use. If you are invited, and I assume that if Kiara was sharing the way we do things, I hope that it was because they asked, oh, how do you do this back in States? You never want to, it's best not to go to another place and say, oh, well, we don't do it that way, we do it this way, or we know better. That's not a good way to handle this, even if you think you know better. Respecting the folks you're working with is very important. And if you have left behind any kind of capacity that what people will be able to use in the future, just think about the multiplier effect of that. Would you agree, Kiara?
Yeah, I was gonna just add that it was like a very great exchange of just like ideas and background, learning about like how the nurses in Mexico, their education is and how that relates to their care now. And they were very interested in learning about like how it's different in the US, and we were able to have a lot of discussions about that. And I think it was very insightful.
Great. And also remember, you will learn, even if people have less technology and fewer resources that cost money, you will often learn about something better you can bring back to your practice as well here. Djine, any comments on this?
Yes, I think my experience was like very similar. Based paraphrasing the feedback that I received, I think the time that I spent there, I was able to help kind of like guide the not kind of guide and shape where they wanted to go moving forward when it comes to like just incorporating nursing into the organization. I do know that with Amazing Grace, when I was presenting, we did talk about like how there were so many things that they didn't notice before that I pointed out, and now they're gonna use it to like shape the mission of what they're trying to accomplish. And I think a lot of like the debriefing and like sharing ideas, kind of like seeing, I think they were really interested in seeing things from my perspective as someone who's been in like the US healthcare system and also spent time in some of the hospitals there. It was a lot of like contrasting and comparing, and then they wanted to know like what can be done differently. Even though I don't have that much experience, I just wanted to know like what are you noticing that's different? What do you think can be improved? And interestingly, we have like conversation about like nursing scope of practice in the US versus nursing scope of practice in Ghana, and how it's like it's not that clear. And that's also something that I know they're working towards like trying to like shape and define, and just like and I feel like another thing that was really well is like when it comes to like shaping this program for the next students, I think they did really value having my feedback on that, just so they can make this experience like way not way better, but like just so they can improve the experience for whoever's participating next year. Um, at the clinic itself, I remember there was that one day they were short in staff. I think when you go there, just like trying to help the staff as much as you can. There was that one day one of the nurses couldn't make it because she was sick, and they do a lot of like paper charting. It's like very different than like when we're here. Then we have the electronic like medical record. They do have that system, but it's like they still have to like chart everything down in like three different books on top of the system. So that one time when that nurse couldn't come, it was just me and the other nurse in the room, and I was just helping her do all the charting. And because I was able to help her do the work, literally transferring details from like three different notebooks and on top of the system, she was able to see all of her patients before closing. Because usually, when you like in like a very in the public hospital, they don't leave until they see the very last patient, and like their day could be over until like by like 2 p.m. But because they still have people, they have to stay until 6 p.m. So really like trying to help them as much as you can. I think that was like one of the things that I really liked. And then before I left, she really thanked me for like helping her with that, because she was like, if I wasn't there, she would have spent like hours and hours just like paper charting all that information. And she wouldn't have been spending that many time with her patient, because she would have to like worry about like transferring the document and the information from one thing to another.
That's great. And Jean, your comments remind me of something else I need to say to every student here. And that is, it is great to help when you are asked to the extent that you would be permitted to help here. So if you are asked to do anything procedural that you have not been trained in here, or that you've not been permitted to do here in the United States without supervision, particularly I'm talking about anything that exposes you to blood or body fluids, you must respectfully decline that offer. As exciting as it may be for you to maybe catch a baby or do something you haven't done, you've got to say, I'm so sorry, I'm not trained, and it wouldn't be ethical for me to do here what I wouldn't be permitted to do back home. Because that is the truth. If here people don't feel you've got enough skill, to do this on your own or without supervision, then you shouldn't be doing it abroad. And certainly we don't expect any of our students who are going for any of these experiences to have blood and body fluid exposure, because we don't have the proper, we haven't set you up for pre-departure testing for tuberculosis exposure, or sent you with HIV, with any kind of post-exposure meds. So please don't ever accept an opportunity to handle blood or body fluids. Let's see, any other questions? But Jean, I did want to hear, but I know you did a little study, so I think on something related to maternal and child health outcomes. I know that was something that Joshua was very interested in. Did you not give a report back to people of some kind, to the Amazing Grace people?
No, we did not like follow up on that. I think that's something they wanted to start, but I haven't like we haven't like touched base on that, unfortunately.
Okay, okay, fine. Any other questions or comments? So what I want to tell you is what happens next then to everyone who's present. You are invited to write to me at any time. If you need to meet, if you want to talk about any of these opportunities. The application processes for all the opportunities are built into those descriptions that when you click on any of the icons on the web page that is in chat, you can find them on your own. But I will remind you, we are going to have a number of additional information sessions coming up. Valerie, when is our next one?
The 18th
The
and then the
18th.
23rd. So for
Okay,
Spain and
18th and the
Thailand.
23rd. The first one is Spain, I think, and the 23rd is Thailand. Is that right?
Yes,
Okay.
yes.
So each of those sessions, tell your friends, classmates who have missed today's session that they can come for that. And we'll do the same thing we did today, begin with an overview. Eric, I think they're both at 12 o'clock and they'll all be recorded. And Emmanuel, you have a question?
Yes, I do. So I'm also a freshman, and I'm already doing a writing seminar this semester.
Yes.
And I realized that the Ghana trip is only for like juniors and like seniors. So is there anything I can do right now, or would I just have to wait until
No, you could definitely apply for the Spain or Thailand course. You can apply for any of the Penn Global seminars. The information for Penn Global seminars and for internships will be available probably in November. Another thing to point out about the GRIP program, which is the internship programs, those are not credit bearing. The Penn Global seminars and all of the classes we've talked about here, you get a CU for them. But for the internships, there is no CU, but it's a fabulous experience. And they also are supported financially by the University of Pennsylvania. So they can be very attractive. So there are many things you can do, Emmanuel. Is there anything in particular you had in mind?
I was really looking forward to the Ghana experience, but unfortunately.
So, and do you have some particular attachment to Ghana?
Yes, I'm from Ghana.
I was guessing. And so Jean said she couldn't remember, but I can remember Ekese.
Yeah.
Okay, that's just an easy way to say hi and you're okay. So Emmanuel, as a freshman, but someone who is how old were you when you left Ghana?
I was 3 years old.
So you would be sort of like a stranger there.
Yeah, but I'm able to speak the language and I'm very fluent.
Oh, Jean would have loved to have the experience with you. So I would say, Emmanuel, if you can find someone in this group who wants to go to Ghana, who is maybe a second or third year, that combined with your language skills, you could absolutely go. I would have no worries about that.
Okay, that sounds good.
Okay. Any other questions or comments? Oh, sorry, I was on my way to telling you what's next. Okay, so I believe for Thailand and Spain, we're going to have those info sessions, and I think the deadline for their applications are something like November 3rd. Again, you will have information you'll have information about Penn Global seminars. I'll be sending emails. You can get on if you go back to that webpage that I told you, and you look at Penn Global seminars, you can click on a link to add yourself to their distribution list as well. So you'll definitely hear from them plus me. I think that's it on the application processes. They're all kind of spelled out from the webpage. But I see Marissa, who I have met, is interested in Ghana, but she's a grad student. So there is some kind of possibility. The problem for grad students, Marissa, is often regarding cost. So we don't have a mechanism to subsidize the tuition costs for graduate students, although these courses are offered in the summer. So we do have a way to eliminate the tuition fee for undergrads, but not for graduate students. So it becomes quite expensive, Marissa. And then there's a question of time, if you have that full block of 4 weeks or not. But it would be great otherwise for you to be involved with this. But let me know, get in touch and we can have a conversation if you like. Anyone else? Any final questions or comments? If not, I want to thank Kiara and Djine for joining us today and all of you for coming and learning a little bit about these opportunities. And I hope this was very helpful to you. Enjoy this beautiful fall week in Philadelphia. Take care. Bye-bye.